Morning, Respiratory family. Just finished up my assignment. Just finished up my night shift assignment. I was working in the ED as well as I had routine checks on general floors. Mainly when I got in yesterday, my general floor work was a few QID treatments, which is 4 times a day. I had a few Q4 treatments. Q4 treatments are usually for asthma patients that through their last assessment had a lot of adventitious breath sounds, meaning they were probably a lot of wheezing going on, maybe some crackles going on. Shortness of breath. Sometimes you get called for PRN, which is as needed. Shortness of breath. Sometimes people just get shortness of breath, walking from wherever they are to, the restroom and back. So sometimes, although it doesn't really help for shortness of breath, the nurses call and want us to do PRNs for shortness of breath. So I had that as well as I had the emergency department. So we had you're never really sure what's going to come into the emergency department. You'll just have a wide array of patients that can come into the emergency department, whether they're unconscious and they need to be intubated for airway protection, so they won't really aspirate and stuff like that, and wind up with a pneumonia. We have patients that come in with CHF. It's basically heart failure. The heart is not pumping effectively. The fluid starts backing up and then gets into the back into the lungs, into the pleural spaces of the lungs. Pleural fusions and stuff like that, which is just basically fluid in the lungs. So it's a wide array of things that the patients come in there for. Sometimes the patients come in there just lethargic, and they want us to get a arterial blood gas just to see the status of the patient, how well they're oxygenating and how well they're breathing off their carbon dioxide. So it's a wide array of things that we do. And between the 2 floors that I had, so mainly the general floor was much more needy in terms of the treatments go, and the ED wasn't that bad, but the ED could get really wild, really crazy, really quickly, and you have to worry about your time management, how to effectively apply the care to the people who need it, who you feel like are most in need of the care right then and there. A lot of times the floor routine work could sometimes wait because they're just it's not exacerbation of symptoms. It's more so they are scheduled for these breathing treatments, but a lot of times people come into the emergency department. They come to the emergency department with an issue or for a reason, or at that point in time they are unable to effectively breathe, remove the fluid, clear secretions, bronchoconstriction. So they really need the care more so a lot of times than the patients on the general floors. But like I said, it was a pretty good night. Just got back to work after having a few days off. So my body was just getting back into the swing of things of working night shift. That's one of the things about working night shift. Like sometimes your body, when you're off of work, you're not used to being up all night for 7 p.m. to 7 a.m. and then going home to go to sleep. Like your body just gets back into this normal circadian rhythm. So that was one thing. My body getting back into the hang and swing of things. But I've been doing night shift for a few years. So I mean, my body handles it pretty well. But it was overall a pretty good shift. I have no complaints. I like what I do. Excuse me. For the most part, for most of the parts, it's dope feeling like you're a part of, a care team, and you're helping somebody out with their rehabilitation, or you're getting them a little bit better so they can be discharged for that night, or at least get out of the emergency department and go up to the ICU if the situation persists, or go to a general floor just for monitoring and finish getting that care. If they don't want them to be discharged right then and there. It was a pretty cool shift, and the team that you're working with, sometimes is important, just for camaraderie's sake, just so somebody has your back when you're when you are in need of something. Like if I had a cold that I was running and I needed somebody to come bring me a ventilator, or if I need somebody to come bag while I get the ventilator, that team that you have, your comrades are important in making sure that the shift runs effectively. So it's pretty cool. Like, I enjoy the people that I work with. I enjoy that I enjoy the people in the emergency department. Like, some of my favorite nurses there at that hospital. And it promotes a feel good environment. Like, if you have doctors and other healthcare professionals who just seem like they're in a bad mood and don't really want to be there, it makes the care of the patient a little bit more difficult, because you're a little bit more apprehensive about even asking this person for anything because they've been giving you such a bad attitude. But like I said, last night overall was a pretty good night. But the ED didn't call too much. And especially sometimes, with having multiple floors, you have to, like I said before, have the time management and divvy your time into what you feel is most important at that point in time. So, it was pretty good. I enjoyed it. No complaints today. This is Respiratory and Fitness family, and we will chat again. See ya.